If you want to know how to keep your loved one at home predictably and out of hospital, out of ED, out of ICU, if they have a complex condition, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecareathome.com. And today I want to talk about one of our clients, actually, which I obviously won't identify. There's a client we're looking after at home with an acquired brain injury, and they have an unstable airway. They're not ventilated. They don't have a tracheostomy, like pretty much all of our other clients, but he still has an unstable airway because he often needs deep suctioning. He needs the airbow, and he needs a lot of chest physio to keep his airway clear and stable. He also often needs to have his head down for chest percussion. So there's a fair bit of airway management going on along the board. Now, this particular client we worked with since August last year. At the time of this recording, it's in the middle of March 2025. The reason our service got engaged to look after this client is that he had something like 75 emergency department admissions over the span of about 12 months, right? And he was more or less living in hospital, having no quality of life. And the family obviously wanted to have a solution, and they found intensive care at home as the solution, including that we were able to successfully advocate for the funding for 24-hour nursing care, because it is much more cost effective keeping this client at home than having him go to hospital all the time, where he's just a number and he will be put on a hospital ward, and no one can really look after him because they don't know the particulars of this client. Anyway, this week this particular client ended up in ED with a query chest infection, and because his saturation dropped, and he was in hospital anyway as an outpatient for a small test, and then he ended up going to ED while he was in hospital for the outpatient appointment. They were doing a chest x-ray and a CT of his chest, and they were finding that there was a chest infection, right? And he was started on IV antibiotics, and they wanted to keep the man in hospital overnight for monitoring. And I obviously objected. I called up the ED and I said to the consultant, I said, look, you can put him on a ward overnight where he will just be a number, and there won't be any staff that know this man, or we can take him home with a critical care nurse one-on-one. And who knows this man, because we have regular teams, and we have staff that know our clients, know the particulars about how to look after him at home. And, after a brief and friendly conversation, the consultant agreed, and we took our client back home on IV antibiotics, to make sure the chest infection is being treated. And we continue with our treatment at home with chest percussions as well, and airway clearance, deep suctioning, airbow, nebulizers, humidified oxygen, all of that. So, and I know for some of you watching this, you will be in a very similar situation at home with your family member, going back to hospital all the time, going back to ICU all the time, going back to ED for whatever reason. There's so many medically complex clients out there in the community that go back to hospitals all the time, go back to ICU all the time, go back to ED all the time. And we can do the same for you. And you should not worry about the funding, because the funding will follow. We wouldn't be in business if we couldn't advocate successfully for our clients, for critical care nurses at home, when there's issues such as unstable airways, tracheostomies, ventilation, when deep suctioning is needed, seizure management. That is not within the scope of a support worker or of support workers. That is not even the scope of a registered nurse, of a general registered nurse. That is actually the scope of a critical care nurse. Another thing that I haven't mentioned is coffees. Some of you watching this, or your family member might need a coffees. And again, that is not the scope of definitely not of a support worker, not even of a general RN. It's the scope of a critical care nurse. And this is exactly what we're providing with intensive care at home. So with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. That means we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy without ventilation, home TPN, home IV potassium, and home IV magnesium infusions, IV fluids, and IV antibiotics. We're also providing ventilation weaning at home. We're also providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're also providing nasogastric tube and PICC tube management at home, as well as palliative care services at home. And we also use cough assist machines for our clients for airway clearance. We're also sending our critical care nurses into the home for emergency department bypass services. And we have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to emergency departments. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs around $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in the hospital, which is the ICU bed. But most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. And of course, quality of life at home is much improved, surrounded by families. So, with intensive care at home, we're currently operating all around Australia and all major capital cities, as well as in all regional and rural areas. We're an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this level of accreditation since 2012. No other service provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. And if you're at home already and you're watching this, or if you're stuck in an ICU, or if you're going to hospital and ED emergency department all the time, and you realize that you don't have the right level of support, I'll give you another tangible example today and real-world example today, very similar to the one I gave a minute ago. So one of our first clients, when we first got started over 10 years ago, was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are dangerous and negligent. And having support workers look after a client at home on a ventilator with a tracheostomy is like flying in the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of critical care nurses looking after them 24/7. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you would not have support workers looking after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in home care, in a home care environment in the community? So this client found out about us eventually, and the ICU that he went back to all the time also knew about us, and eventually reached out to us. We were proving our concept with this client very fast. When we worked with the client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again. And we were proving our concept there very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients. Otherwise, we wouldn't be in business. The same is applicable for those stuck in ICU. Similar to our case study today, or going back to ED all the time. So what you're looking for, reach out to us. We'll make it happen for you as well. We can take you through the right steps, including NDIS or other funding bodies, and the advocacy that needs to go along with it, which is also why we are providing level 2 and level 3 NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Riches, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCotter. And if you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We will help you with the right level of funding and with the right level of advocacy. We're also providing NDIS specialist nursing assessments done by critical care nurses with a legal nurse consulting background. If you are a critical care nurse and you're looking for a career change, and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we are employing hundreds of years of critical care nursing experience combined. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years in pediatric ICU, ED, and ICU, of course, you have already completed a postgraduate critical care nursing qualification, we are delighted hearing from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are very vulnerable and very special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We're looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts. And if you're really keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, home TPN, please reach out to us as well. We help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below on what you want to see next, what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days.